Republic of Nigeria for the choice he has made in bestowing the leadership of the Federal Ministry of Health in competent hands. In my over 2 decades of leadership within the NMA and the health sector generally, I've not seen a situation where all leadership within the unions in the health sector have come together to unanimously agree that a minister of health is doing what they believe is in the right direction to deliver quality healthcare for Nigerians.
18 months or so of relative peace that we have had in the sector. I think since this administration came, I believe we have tried to build a constructive relationship with all the health workers in a mutually respectful manner, and tried as government to earn the trust of health workers and for you also to earn the trust of government. Outstanding issues for many years, we've tried to continue to discuss them separately with individual unions or collectively as the case may be. So we don't take it for granted. And I want to convey to you the appreciation of our leader, His Excellency Mr. President, for all the great work that Nigerian health workers are doing all over the country. The second element on the arrears, we had several correspondences with other parts of government to see that the 7 months arrears is deferred. That is from June to December 2023. His Excellency, in his wisdom, also has approved that the sourcing to happen and the release to happen. So that is a key step which is in writing that are pertinent for you to know, which are still work in progress, but at least we're moving closer to it. One of them is the issue of the outstanding Conhess arrears, the 7 months arrears. The other one is the issue of the extension of the retirement age for clinically skilled health professionals. Let me say that on both fronts, I think we have made important breakthroughs, and we see a resolution ahead of us. On the issue of the retirement age, which has been a long-standing issue that you had been advocating, we know the challenge of human resource shortage in Nigeria. Every day our hospitals suffer from folks japping, and the workload on nurses, pharmacists, lab scientists, medical doctors increasing. But we're seeing that trend plateauing. In the last 1 year, we took certain steps, accelerating the waiver process so that we're able to recruit easily, at least in the federal side, and we fastened that process. We increased the training quota for medical school, pharmacy school, nursing schools, even though the accreditation to ensure that the quality and the standards are met is also important. We have expanded the infrastructure. Many new schools of nursing have been brought to life, and many other additional hospitals. But that's not it. Health workers also are skilled professionals, and skills increase with age. In consideration of the acute situation that we have, His Excellency Mr. President agreed that we should follow due process to get to the extension from 60 to 65. We have it, and we are working very closely with our own ministry here, the Permanent Secretary, and the Office of the Head of Civil Service of the Federation. As you know, this is the matter that had been tabled previously at National Council on Establishment twice, and unsuccessfully so. because perhaps the way it was framed, perhaps because of the depth of the stakeholder engagement. But with this note that we see the genuine intent of Mr. President to work through due process to actualize it, we now are kicking off a process between the ministry, and I will assign the team that will work with you, but you as professionals to work with us to develop the memo that then we go to the Council on Establishment to conclude it.